I have taken up post as head of clinical operations across the Tierco Healthcare group.
So we wanted someone very good. That's why we were very keen to have you on board. Someone that was at the cutting edge of all that clinical research. The 24-hour conference, that's the first that we've put on, and it's going to be very exciting. Lots of professionals there, leaders in their field. So we want to encourage as many people as possible to get there. And we're giving away some free tickets. So we're going to put a link at the end of the podcast to encourage people to come. Welcome to the Martina Tierney Podcast. I'm sitting here with Norma. Welcome back, Norma.
Thank you so much for having me back.
So Norma Findlay is with me today. We interviewed Norma maybe a year ago, quite a while ago anyway. And at that stage, Norma, you were still running your own business, a medical legal practice in Scotland.
Yep, that's right. Yep.
And since that, we have managed to win you over, and now you're working for the company here. So just for the benefit of those who don't know you, Norma, can you tell us what your role is within the company?
Yes, so you're correct. You won me over. That's true to say. That's a good description. I have taken up post as head of clinical operations across the Tierco Healthcare group. So that includes A1 Momentum and Postural and Seating Matters. And we have a team of clinicians across the UK. So I was very much drawn by, obviously, I've known Seating Matters for many, many years. But we had some great chats about how we could work together to have a greater reach across not just the UK. I now have the privilege of covering some amazing countries.
Yeah,
thanks to you.
So let's go back to the beginning. Obviously, at Seating Matters here, we are always a clinical company first. And I am an occupational therapist, and I really wanted to make sure to maintain that clinical and to improve and enhance it, because I know my limitations, because there's so much more going on, there's so much evidence. So we wanted someone very good. That's why we were very keen to have you on board. Someone that was at the cutting edge of all that clinical research. But also, could you just explain to people listening, you mentioned Tierco Group.
Yeah.
Now, I always talk about Seating Matters, so just explain what Tierco is, so that for people out there, where there's total clarity around where Seating Matters fits into that.
Yes, so Seating Matters, as I had always known and worked with yourselves for many, many years too, was the mission of giving caregivers the means to care, then have grown to expand that and truly offer whatever that caregiver needs. So that includes moving and handling training through A1 Momentum now, which was A1 Risk Solutions. So now we have a greater opportunity to not just look at positioning, but transfers every day. And we have a great training team in delivering that training.
So that A1 Momentum is like a training hub.
That's right.
And that's where all the training will come through, like the moving and handling, the 24-hour posture, and the seating training all comes through that A1 Momentum.
That's right. So a lot of the focus is on accredited training, so that therapists, healthcare professionals, assistants can articulate what level of training they have. So most of our courses are accredited through ROSPA, the Royal Society for the Prevention of Accidents. So it allows them to be able to, if they're moving from one, say, trust to another or local authority to another, to be able to explain what level of training that they've received. So all of our trainers are registered healthcare professionals, either occupational therapists, physiotherapists or nurses. And they're also able to provide that clinical expertise and support to the seating specialists within Seating Matters. And also we can upskill, we do educate our seating specialists so that they now have training, and most of them, to be fair, would have done in the past, but we can upskill them in safe moving and handling, and with a lot of the developments of techniques, new products, etc. So there's a perfect overlap there. But of course, overarching everything is that need for positioning and 24-hour postural care.
Yeah. Okay. So the Tierco Group takes in the A1 Momentum and then Postural. Tell us what Postural is.
And Postural is an essential part of that journey. So we look at a person who needs protection of body shape. That may include assistance to transfer with regards to manoeuvres, but also they may require assistance with hygiene, so for toileting and wheelchair or chair commode. And Posicare provides that same postural care during the time that someone is showering and bathing. So it's a safe solution for hygiene and bathing, and it protects the body shape during that time. So many of the people that we would support spend up to a couple of hours potentially over that 24-hour period being assisted shower or to use toileting facilities, etc. So Posicare is a fantastic complement to that, and we can inform. So clinically, our therapists can have input to the design and improvement of anything that the Posicare, because of course it's manufactured in the UK, so we have a wonderful HQ for Posicare in Wigan there as well.
So it's very exciting for me that, while Seating Matters started off looking at the person in the chair, then obviously we became very aware of how did we get the person into the chair, so how did we transfer them. Then we were very aware of, well, it's not just about the chair and the transfer, it's about how they lie in bed for the 10 hours and all the other surfaces. So it is so good to have that whole overarching look at the person, holistic view, not just looking at one particular. So what is your plans now as head of clinical operations for the Tierco Group? What do you see moving forward? What are your plans for it?
So we continue to support many trusts and local authorities across the UK and indeed beyond just the UK as well, but in implementing proportionate care. So we are responsible and really honoured to be able to assist large-scale implementation of proportionate care, and we will continue to do that. And because that's our best practice guidance, so we have the high impact change model that we're able to enable that best practice to be met across the UK. So we'll continue to do that, but as well as that, we have the expansion into education on 24-hour postural care. So we now can offer that as a training course, which, as you rightfully say, includes therapeutic lying. So we've mentioned Posicare for that hygiene part of the day, transfers for moving and handling, seating, of course. We have wonderful solutions for our seating, but now we have Posicare as well. So the 24-hour postural care side of things. Now, much of our work would take place within the community setting, but we've had the privilege of being able to work with hospitals and acute side of things for training. We've also been able to look at some of our fantastic findings from our audits and the introduction of therapeutic seating within hospital settings, including acute. So that's really raised the questions about the type of seating that we have available to those on their rehabilitation journey, whether it be initially at acute stage or further down the line. Are we providing optimal or safe options within hospital? And that's work that I've been focusing on with in terms of research with Queen Margaret University. So we are scoping out that now so that therapists can have the evidence to look at the benefits, not just from a protection of body shape perspective, but also from a reduction in pressure injuries and falls as well.
And who are you working with at Queen Margaret University?
So we have a wonderful team there. We have Duncan Pentland, who leads up the occupational therapy department at QMU, but we also have Professor Cathy Bewley, who is physiotherapy lead there, and we have connected with a wonderful fellow of the QMU, who's Dr. Charlie Chung.
He was on our podcast.
He was, and actually he could see directly from his visit here how the therapeutic seating systems would benefit, especially those within post-stroke, so in the neuro setting. So they've been extremely helpful in looking at, well, how can we map out the patient's journey and allowing them to have an appropriate chair to actually transfer into. So if especially post-stroke or brain injury, any neurological damage, and that acute stage onto rehabilitation, how can we allow that person to transfer out of bed and to move to prevent deconditioning and also to avoid I guess what I'm grateful for is to make sure that we're part of the reduction in avoidable harm.
Yeah.
Because you mentioned the medical legal side. That was a lot of my input, was where we would see avoidable harm. And it was much of the reason I joined you is because really we want to be part of that improvement in care standards and avoidable harm.
So what we're doing now is, and you are leading this up, we're doing the first ever 24-hour conference coming up in June.
We are.
You excited about that?
Very much so. I think it's, getting the best people, the leaders in their field, those that have inspired me over the last 25 years. And really, I would say probably over the last 10 years, where we have had people who are leading the way and are very experienced in being able to share that with others. So if we can bring together everyone who would benefit, and their patients, their clients would benefit from that input, whether it be paediatric services, those working with children, right the way through to older age, those working with people with dementia, diagnosis of dementia, then that will be an excellent opportunity. We truly have, in my opinion, thought leaders in the field with the best experience and expertise who will be talking at the conference.
We want to encourage as many people as possible to get there, and we're giving away some free tickets, so we're going to put a link at the end of the podcast to encourage people to come, because it's going to be really beneficial. It's in Newcastle, is that right?
It is, yes, St James Park in Newcastle. So Newcastle.
On the football ground?
Yep, that's right, yep.
Oh,
so
very good.
Wonderful venue, and we do have an agenda there that's definitely worth checking out. So it doesn't matter, all the speakers are appropriate, whether you're working with children or adults. We've ensured that. So great opportunity, giving some of those passes away. That's amazing.
Very good. We also, when we do our master classes, we'll probably in the future try to bring in more about 24-hour posture and proportionate care. Like up to now, our master classes have been very much focused on the seating element, but with your influence and with you coming on, do you think we're obviously will be given a bit more information at each masterclass on 24-hour? Would that be something you would agree with?
Definitely, yeah. It's included more, and we have we work in partnerships at times with Simple Stuff Works, who have been extremely helpful in providing us with some of their therapeutic lying systems, because if we think about it, those 12 hours, potentially more, that the person is spending lying in bed, and I talk to some case examples where the patient that I've been assessing hasn't quite been ready to transfer out of, so say maybe 18 months spent lying in bed unsupported, and their body hasn't been ready to sit in one of our therapeutic chairs yet. But with a few months of therapeutic lying, we've then graded that towards sitting up, and that's really aiming towards their goal of then being able to eat, have meals out with, rather than eating in bed and being assisted in bed. So we're definitely incorporating that more, and therapists are asking for the training, they're asking for more information and how they can implement that. So that's really helpful.
Very good. So tell me about the team that you're building, Norma, around the UK. You're building up a team of professionals to work with you at Tierco. Tell us about the team.
Yeah, they're a wonderful team. They're great. They're very highly experienced. I've mentioned they're all HCPC or CORU registered in the south of Ireland. So we're trying to respond to the need across the whole of the UK, because we have the need to support trusts and local authority all the way down the south of England and all the way up to the north of Scotland. In fact, we have the whole of the Western Isles that we train. So we want to support and provide, ideally, those therapists who have a local knowledge as well of the services there. So that is ideal. But they are all highly experienced clinicians, and they understand the importance of moving and handling, proportionate care and positioning. So that's really the ask there, and hopefully we'll be part of that, assisting to those newly grads, the newly qualified therapists coming out and supporting them in their journey as well.
And your team is right through from the north to the south, from the north of Scotland, have you got someone to cover most areas yet? Have you got nearly every area covered, or what way is that geographically?
Yeah, we almost do, although we could definitely have more further down south, so the very south of England, Portsmouth, for example. We could definitely benefit from having, because we'd still have quite a bit of travelling to do. So yeah, if any interested and experienced therapists, they're always keen to hear from them.
Yeah, so a shout out if there's anybody out there would like, because not all our therapists are full time.
That's right.
They're part time.
Yeah.
And some of them are associates and some of them are full-time employees.
That's correct.
So there's a variety of options available.
There are, yeah. And of course we are very much one team. And as you mentioned, some are associates, so they will have their own private practice in OT and then will be training for us in addition to that. But we do have a core clinical hub, which is myself, and we have Kat Stafford and Kirsty Ryan, of course. We are very much part of that clinical hub within Tierco Healthcare.
Very good. Well, thank you so much for coming on and clarifying that. And again, I am delighted to have you on board. Your expertise is phenomenal and all your experience and your skills. And it's a pleasure to have you on board. It takes a lot of strain and stress from me, knowing that everything has been so well looked after in the clinical field. So thank you so much for everything that you do.
It's my pleasure.